Good afternoon, Commissioners. So I do have in your packet my monthly report relative to activities occurring at Lifeways. There are a couple of things that I would like to give an update on that was not included in the report. Again, I apologize for that, but there's been some activities for the millage. So I wanted to just appraise you as to where we are with the use of those dollars now that it is January 1st. So we have already implemented the work around the jails and have a clinician that is on site and providing mental health screening and counseling and crisis services in the jails. She goes to both sites, actually. And the other thing that we're doing is we're helping to coordinate care after discharge to prevent recidivism back into the jail. So that is moving along. We are excited about the Stepping Up initiative, which the county has been a key part of, and there will be a follow-up meeting. We're looking at the 5th of February to share with the county and the commissioners the outcome of our technical assistance that we've received from the state. So it is an exciting opportunity to look at that and look at what we can do collaboratively moving forward around mental health services in our community around the jails, both pre-booking and post-booking. So I would invite you to participate in that. We should be hearing soon about confirmation about that date. The other thing that we're doing relative to the use of the millage dollars is really being able to provide services for people who are underinsured or uninsured, who do not meet the qualifications for Healthy Michigan or for Medicaid. We began January 1st providing services, array of services, case management, psychiatric services, crisis services, and outpatient therapy to individuals coming in who before we would have tried to connect with somebody in the community. So nobody should be being turned away. So that's what I want you to hear. If you at all as a commissioner here are concerned about that, please bring that to my attention. But that all started January 1st.
Mary Beth?
Yes.
The prisoners who are discharged, okay, and you have a program for them after they're discharged, are you having any problem with the providers in the area who will accept them or not accept them?
Well, if they qualify for services, then obviously they would be connected with Lifeways. Some of them are already connected with Lifeways, and they already have a provider, so that individual that's working there at the jails is coordinating that care with those providers. We do not have an issue that I'm aware of that's been brought to my attention that they're not connecting follow-up services.
Okay, thank you.
Yeah. So that's occurring relative to the uninsured, and that's really a primary thing that we're doing. I will be reporting on a quarterly basis to the county, giving you outcomes relative to the number of people that we've been able to serve as a result of the millage. So I look forward to that. We had to put into our electronic medical record an ability to record and track, and that's all in play. So I'm excited to start seeing what the data starts showing us relative to how many people are being served, what level of services are being provided, and how much is it costing us. Because the important thing to remember is when I did the proposal to the county, one of the things that we did is we estimated based on prior data relative to the number of people we turned away. We're going to be watching that on a quarterly basis. If we get to a point mid-year or maybe late summer where we are either in a position of we're going to be overspent on those dollars, we will have to put in a waiting list for those individuals until the next funding for the millage dollars occur in 2020, or maybe we will be in a position of being able to open additional services if the funding is there. So just stay tuned. Again, I will be reporting to you on a quarterly basis about that and how it's going. The other thing that we did as part of the millage was looking at the intellectually developmentally disabled And as you might recall, one of the things that we wanted to utilize millage dollars for was a social enrichment program for those with intellectual developmental disabilities after the age of 25. And we did issue an RFP, and we have selected a provider called Club Life, so that they are we are right now negotiating the contract, and they're going to be starting to provide those types of services. And again, I will be reporting quarterly as to how many people they're serving, what kind of service, social enrichment programs that they're providing for our community. So I just wanted to give you an update about where we are. The other thing that I always like to keep you appraised of is because it is a critical concern as a community is around inpatient, psychiatric inpatient. You're well aware of my discussions about the struggles with inpatient capacity for psychiatric across the state. One of the things that we're noticing is that there has been a significant increase since 2016 here locally relative to the need for psychiatric inpatient. For example, in 2016, on average, we had about 200 people monthly that were at the hospital needing a screening for inpatient. We are now at about 230 average per month. So that's a significant increase. If you annualize that on an annual basis, the numbers just keep going up relative to, and it's not unique to our community. I will just tell you that is a issue that we're experiencing across our region as a community mental health system and across the state. So the need to really look at statewide options for diverting people out of the emergency room is critical. I will tell you that as a local community mental health, we have options for diversion. So we have a crisis residential program for those who do meet criteria for inpatient but could be served in a less intensive setting in the hospital. It does cost less. The other important service that we've implemented this past year is a mobile service. So it's a mobile crisis service that they provide both for adults, and we've expanded it this in December for children to be able to provide supports to keep the people where they're at, whether it's their home, could be their potential specialized residential, maybe they have an apartment setting, where we can keep them safe and keep them in their own setting and keep them out of the hospital. It's a mobile team. So we are excited about that, but those are all important things that we need to continue to work on to meet the needs of our community. But I thought it was important to keep you appraised about what that looks like locally, because you might be seeing articles in the paper, both at a statewide level and nationally, about the crisis with inpatient and boarding. In your packet, you'll also see where we are relative to our new strategic plan that began this year. We have 4 overarching goals, and it just kind of breaks out what are those 4 goals that we're working on over the next 3 years and some action that's occurred on a monthly basis. The other important thing that's in your packet probably for discussion is relative to the funding. So there has been, you might have seen this article in the Cranes in regards to the fact that the health plans are even more aggressive, if you will, relative to the privatization of the public mental health system. And there are 4 current PIHPs who are struggling and are currently in what's called the risk reserve corridor, where they've utilized all of their risk reserve and are in a situation in which the state has to then cover the unfunded services that they're not able to meet. The challenge is that there's many issues at play that are impacting that issue. Everything from the growth of autism services statewide. Autism has expanded tremendously. We went from about 30-some people on an annual basis to over 200 individuals, and the service is pretty expensive to provide, and the growth has been significant since 2014. You also are well aware of the fact that our general fund was cut. So when general fund when CMHs across the state experienced that, the Healthy Michigan did not replace that 70% reduction. So you're already going into a situation where you're still having to provide the same level of care for individuals on Healthy Michigan, yet the funding isn't the same as the traditional Medicaid. So there's many factors impacting that, but just know, if you have not seen that article, it is out there. It has been the threat for quite some time relative to Section 298. As a community mental health, we're continuing to do what we need to do relative to ensuring that we can provide the best care at the lowest cost and continue to do everything we can to drive down the cost of care. So I just wanted you to be aware of that. In the event you wonder what does that mean relative to the local community mental health. But I guess stay tuned. Well, it's, with the new governor-elect, not sure what her position is relative to privatization, but maybe in about another month we'll know a little more when she makes the appointment that oversees our area. And that is it for my report, unless there are any questions about anything in the report or anything verbal that I reported.
How you doing, Mary Beth?
Good, Daniel.
Good. Just a really quick question, if you could touch on where we are currently with the, in September, there was a request that we approved for a capital improvement bond for comprehensive renovation.
Yes.
I just wanted to know if you could just give a brief update of where we are with that renovation.
Well, where we are right now is that the closing for that is supposed to occur on the 24th of this month. So Lifeways was in the process in December we issued an RFP for the architectural work. We have selected and are in the process, our board approved last month to enter into negotiations with an architect. I will tell you that I'm happy to report that we were able to get the cost from 6.5% down to 5.75%, so it's a savings. Now that we have we'll finalize that contract with, I'm hoping by at least actually by next week's board meeting, so that we have the ability to proceed with finalizing the work with the architect, and then working with the county relative to procuring providers for the work. So that's where we're at.
Just a comment, Mary Beth?
Yes. Yes. Yeah. And I think if you look at the data trended over time, whether it's adult or children, it's continuing to grow, the needs for mental health services. Anything else? No. Will you all have a good afternoon? Thank you.
Good afternoon. I'm Marcy Wandell, and I'm the department head for the Department on Aging. And what I wanted to do this afternoon was just give you a quick overview of the services that are provided by the Jackson County Department on Aging. And our mission is to help older adults to live more full, active, and independent lives. And we have a two-prong approach for that. We want to help people stay active for as long as possible, and we do this through our different senior centers. There's 2 senior centers, and there's 6 senior nutrition sites. We offer exercise classes. nutritious meals, educational classes, craft classes, so we want to keep people moving, engaged with other people. And then we also, our largest portion is home services, and I'll get more into information about that in a moment. So I mentioned the classes that are available at various senior sites, and the number there of the senior nutrition meals that were provided in 2017. And each meal, whether it's what we call a congregate meal or a Meals on Wheels meal, it provides 1/3 the nutrition for an adult. And here's a list of the senior sites that are available in Jackson County. And the two at the bottom we call Food with Friends. There's one at Grass Lake Senior Center and one at the King Center in the city of Jackson. And that's the preference of those two locations is for us to drop off an individually packaged hot meal, and then they have staff on the premises who then distribute the meals for lunch, and then their staff provide programs, organize activities. And also with all the sites, a cold meal is available a couple times a week so that people can take a cold meal home for the evening meal. Home services. A lot of what we do is give information to people who want to know what services are available, whether it's through the Jackson County Department on Aging or another community resource. But at the Department on Aging, we have workers who provide personal care, which is bathing assistance, also homemaker, which is routine light house cleaning service. We have respite, which is where a worker is in the home so that the caregiver who's giving around-the-clock care can leave and do what they need to get done as a caregiver, and then our worker stays with the care recipient who needs that around-the-clock care. Chore is installation of grab bars is the largest thing we do, or repairing handrails to keep people safe in their home. And then unmet needs, there are some limited funds to help one-time kind of purchases that people may have, and we do have a grant that supports that program for caregiver unmet needs. So our social workers, they do in-home assessments, so anyone who receives Meals on Wheels or homemaker service or respite, there's a face-to-face meeting in their home with one of our social work staff, and that happens initially and then every 6 months so that we can touch base and see how they're doing, connect them with other services. We do have counseling services primarily it's people who are homebound, but it also, there's appointments in the office. But a lot of times people who are experiencing loss, one of the losses is mobility, and it's difficult for them to get out for an appointment in the office. So our counselors will go to them for short-term therapy. And also counseling with caregivers who may be dealing with some difficult situations with their caregiving situation. We also have memory and depression screens, and this is in partnership with Lifeways. And so someone wonders, is what I'm forgetting normal or should I be concerned? There's a memory screen and then also a depression screen for people who are concerned. And the way the social work staff approach people, they don't feel like they're being told they're depressed, but it's a conversation to find out if perhaps counseling or other services may benefit them. Gatekeeper is a service so that if someone wonders if my neighbor who has hasn't left their home very much and we just wonder if they're okay, it's not really an adult protective services referral to Department of Health and Human Services, but they're concerned about a family member or friend or neighbor, they can call us. And again, our social work staff have a way of approaching people and saying, I would like to come and talk with you about what services are available. And we don't go in and try and tell people they need to move away from their current living situation. That's not what we're there for. We're there to give them options and what options are available in the community. Meals on Wheels is the largest program, and in one day, 470 older adults will receive 1 or 2 meals that day. People can receive up to 14 meals in a week. Meals are available for the weekend. They're delivered frozen for people to warm up over the weekend, and then cold meals for supper and hot meal for noon. We have 14 meal routes. Before I go on to the financial component, any questions about home services or senior site services? Okay.
Mr. Chair, I do have just one question. If I was trying to kind of take notes a bit, but could you kind of explain a little bit more of the gatekeeper services and how that differs from an APS referral?
So gatekeeper is for someone who mentally is able to make their own decisions. And a lot of times when it's an adult protective services referral, there's a question of whether the person is harming themselves or someone else, or they're being harmed by someone. So when it's possible harm to themselves, that is adult protective services. But if it's more of a, I'm not sure how they're doing, I'm concerned, I don't know if they're in danger or not, our staff person would go in and talk with them. And if our social worker finds out that, yes, they are in danger, they're not making appropriate choices, then we would refer to Adult Protective Services.
Okay.
Yeah.
Thank you.
We receive funding through what's called Older Americans Act, and that's a program that started in the federally in the 1970s. So the 40% of our grants is through the Region 2 Area Agency on Aging, and there's state funding and federal Older Americans Act funding. And then the largest portion is the $0.25 on property taxes, that's senior millage. And then there's other revenue sources that are listed there. So with the Older Americans Act, we don't charge a fee, which makes it more acceptable for a lot of people to receive our services. We have suggested donations and suggested fair share contributions, but we don't have set fees. That's a requirement of the Older Americans Act, that we don't charge a fee, and any donations are anonymous. We don't track who donates what, so that people are served no matter if they donate or not. And we really encourage people, call us if you wonder what services are available. Older Americans Act, we do serve age 60 and older, but caregivers of any age, we want to let people know, again, what services are available. We have good resources listed on our website with the county, lots of resource lists, but we will also print those off and mail them to people. Like someone might wonder what senior housing apartments are in the community, what home health care agencies, what legal services are there. So we give information to people, whether they call or walk in. We also have 2 major events a year. We raise money with the Friends of Jackson Seniors. They're a nonprofit, and they have a fundraising campaign called Soups On for Seniors, and the event is held the first Thursday in March. It's March 7th, and the last 4 years they've been able to raise enough money to almost pay for the entire cost of a meal delivery van. That's their goal. And then we have a community outreach event, and it's called the Classic Car Festival, and we partner with the fair staff, and it's held at the Fair Events Center in September. And then again, on our website, there's a list of senior resources that people can open up and print out. And we have about 79, 80 employees. 14 of us are full-time, 24 are part-time, and the majority, 41 plus, are casuals. So our meal transporters are paid minimum wage. We found that this is helpful because they get to know people on the route, they're reliable, they will call. Part of Meals on Wheels is not just the hot meal delivered and the cold meal, but they check on the person, and if something seems amiss, then they call the office. Our office personnel call an emergency contact. They make sure the person's okay. If they're not, then 911 is called. So it's a meal and a check on that person. And then we have our nutrition site leaders are casual, and some of our home care workers are casuals. So, any questions? Okay. Thank you. Yep, yes. For some, the meal transporter is the only person they'll see that day, if not during the week. Yeah. Some are pretty isolated.
Thank you very much.
Okay, thank you.
Good afternoon to all. And for our new county board members, I'm Richard Toon. I'm the Health Department Director and also the Health Officer, in case you're wanting to put a name with a face. My report, of course, is in board docs, and if you've had an opportunity to look at it, I have a few things I'd like to highlight that aren't in the report. But I wanted to give you kind of an overview today to make sure that you're aware that we do have a small project going at the Health Department with Jackson Health Network and the Jackson Community Medical Record involving preventing lead exposure in pregnant women. This is a project we've been working on since June of last year, and I've kind of given you some background information about what the ultimate goal is here with this project is to prevent in utero exposure of the developing fetus to dangerous lead levels via the maternal route. So this is being built into EPIC. It will be visible to all of our family practice physicians and our OBGYNs who are on EPIC here in the community with Henry Ford Allegiance Health and the health system overall. And what it will do is create a referral opportunity to the health department for us to make contact with the pregnant woman to actually go through the process of assessing whether or not she has any exposure risk for lead. And if we identify that as a result of using the questionnaire that we put together, we would offer blood lead testing to the woman, and if there was an elevated level of concern, then we would also offer case management services which take place in the home, trying to help her figure out where is the lead exposure possibly coming from, what can we do to prevent any further exposure. So in a nutshell, that's kind of what that small grant is about. It's only about $15,000, but the number of women that we expect to be affected is also very low. Lead poisoning in adults is a pretty rare event, if you will, but up to 1% of women can have risk exposure to lead, and about 0.5% may have an elevated level. So this is a small number, but still lead is a big concern in Jackson and has been for many, many years. So we thought this was an additional opportunity we could take advantage of through funding from the Michigan Department of Health and Human Services. We wrapped up the United Way campaign. I served as the county council chair for that for the 2018 campaign, and we were able to collectively, with the help of the medical care facility staff as well and leaders, generate $24,000 in contributions or donations to United Way, which will go a long way in helping to support the overall collaborative work that we do in the community. I may have mentioned last time that we had an opportunity to apply for up to $7,500 for the Jackson Community Foundation. We did that, and it will help support further implementation of our Get Real Experiences and Learning Summer program, which is part of the Teen Pregnancy Prevention Initiative. So that will take place this summer. It'll allow us to extend our program hours on field trip days, give us an ability to expand the amount of days that we offer it, and we're also be able to hire 2 additional mentors for the program to allow for smaller group sizes. So Administrator Overton has taken care of signing that particular grant for us. Like to share with you periodically information about immunization and immunization rates in the community, if you will, and we have a closeout report that's identified in my report for you for October 2018. Denise Schoenhardt is our Immunization Action Plan Coordinator. We have 53 child cares in the community. 39 or 74% of them closed at a 100% compliancy rate. And compliancy basically means that children are up to date on all required vaccinations under the state public health code, or they have a medical waiver or a non-medical waiver in place. So any of those 3 represents compliance. I don't think I need to read all of this to you. I'm just kind of looking down at the bottom to kind of share with you that the waiver rate for our preschools and child care has increased from 3% to 5% compared to last year. I'm comparing that to 2017. So it's a little bit of a bump up. We think there are some reason that this may be occurring. Sometimes it's changes in reporting practices within or between different school buildings, or age-specific children that happen in one of the facilities in the community, so that can affect the overall count for the waiver rate purposes. We like to keep it as low as possible for obvious reasons. It helps to prevent disease outbreaks in these congregate or institutional settings. We have had so far one confirmed case of acute flaccid myelitis in Michigan, not in our county. It was identified in Wayne County. I believe as of today, there are probably a couple more that are being investigated, and 7 suspect cases in Michigan remain under investigation. We don't really know what causes this in young children. It's rare but serious, and it can affect the nervous system, the gray matter, and causes muscle and reflexes in the body to become weak. So it's a concern. This is not the first time we have seen this on a national basis either. Seems to be a bit cyclic in nature, and we still don't know exactly what it is that causes it to take place. Could be everything from a virus to something else. So I'll share any further information on that I get my hands on as we learn more. There were a couple of House bills that were introduced in the lame duck session of the legislature. I've provided copies of the communications that we initiated to Representative Alexander and/or Representative Roberts before he vacated his position at the state level. And mostly our communication was to express our concerns and opinions about what these bills might mean for us at the local level. We were not opposed to the statewide sanitary code, but there were some provisions of it we had concerns about. So that's kind of laid out in that letter. And prohibiting restaurant inspection grading system. We don't have a grading system here in the county. We don't really have a plan to establish one, if you will. But we thought that if the issue of grading inspection systems was going to be addressed at a statewide level, at least what we should do is standardize it so everybody's doing it the same way. That made some sense to us. So that was our primary message to our representatives at the state level. Yes, sir.
Recognizing the chair. Through the chair, if I may, we originally, back in the early 2000s, removed the grading system where it was based on percentage, and went away from the adversarial position that restaurants had with health sanitary code inspectors, and went to an educational system and a system of making sure that everyone was trained and that we had a training staff. At the end of the day, did anything change in lame duck? Did they pass anything, or did it not come out?
Neither one of these bills made it through lame duck and was signed by the governor. In order for anything to happen, they have to be reintroduced. Yep. I did not know that we might have had a grading system in the past. I appreciate that.
What we had was you scored points, and
Yes, it
what was
was.
occurring was
Yeah.
the restaurants felt that it was us versus them type attitude, because some restaurants would receive and would let things pass until next inspection, versus somebody who maybe didn't agree with that the particular inspector would score really poorly. So
Okay.
there was a lot of inconsistency.
Yeah.
And so when we went to the system we currently operate under right now, we found that the restaurants at first were a little nervous about the change, but have become very receptive to the educational process and pointing out what's going on and how they can best correct the situation. The next thing I would say, I would argue that past history shows, since we've gone to that, and you'd have to correct me if I'm wrong, but I don't recall any foodborne outbreaks in the last 10 years in Jackson County, since we've gone to this system.
Right, there haven't been any since I've been here,
Correct.
and that's at least since 2013.
I think that's a very positive
Yeah.
for the current system our health department uses with restaurants.
You're right that the previous inspection report process resulted in a percentile grade, but what this bill was trying to do was to prohibit local jurisdictions from actually publishing or placing like an 8.5 by 11 certificate saying what the percent score was. That's what this was about. Right now, we're using an inspection process that looks primarily for critical violations and getting those corrected. So, and that's really what we need to focus on. Yeah. Couple other things. I participated along with quite a few of the health department staff as well last week with DEQ representatives last Friday to talk about the Missioner plating plant on North Mechanic. As you're probably all aware, we've had 2 testing results out of 6 samples, I think, come back for PFAS, which is the long-chain hydrocarbon of concern, if you will, in water supplies and environmental contamination, if you will. There are 4 monitoring wells on the west side of the plant between the building and the railroad tracks. So if you can kind of create that visually in your head, that's where those 4 wells are located. 2 of those tested positive. One of them was over 9,000 parts per trillion, which is quite high. So I think in our favor, what we have working for us is that we don't have any residential wells close to this particular plant. They're at least a mile and a half away. And the municipal wells located further north, 2 to 2.5 miles away in Blackman Charter Township, have already been tested and are non-detect for this chemical compound. So there's no evidence or indication right now that this contamination is moving in any direction where it would impact municipal water supplies or private drinking wells right now. There is concern about potential contamination of the Grand River. That plant is so close to the river, we could easily make the assumption that the groundwater flow is toward the river. It might be, it might not be, we don't know yet. So additional sampling is planned around the plant with more wells. They're looking at trying to figure out how far has the contamination spread from the plant, and the only way to do that is to drill some additional monitoring wells, which will probably be off the property itself with landowner permission. They'll also be testing soil, and in particular sampling it for vapor. Vapor intrusion is as much a concern, maybe a bigger concern if you will, than the actual PFAS contamination that's there at that plant. They use trichloroethylene, perchloroethylene, vinyl chloride, which are all carcinogens and capable of moving through the water aquifers if they can get that far. And also they have the ability to move with water under foundations, come up through basement cracks and floors and things like that. So there's a real concern about that potentially being happening. There aren't any residential homes right next to or right near the plant. The closest facility is the auto parts store directly north of the plant on North Mechanic. So additional investigation is underway. Sampling of the Grand River is already underway. And depending on what they find in the samples of the river, the levels may suggest that they need to do some sampling of fish as well. People do fish the Grand River. They can obviously fish and consume fish that might contain PFAS levels of concern. So you're going to be hearing more from us at the health department about how this is going. And if any of you are interested in participating in any meetings with the DEQ that we participate in, you are invited to do so. Just let me know. Otherwise, we'll keep you pretty well informed. The last thing I'd mention, if you're not already aware of it, it's not only influenza season, it's also norovirus season. We've seen quite an uptick in surveillance activity and monitoring from the state level. Norovirus is usually a quick 24 to 36 hour virus that moves through people pretty quickly, but it is pretty debilitating and can knock you down for a good 36 hours. We're seeing quite a bit of that right now circulating in the state. I haven't seen it pop up so far yet this winter in our institutional settings, which is usually our skilled nursing facilities in the community. Usually that's where we see it and we get reports, but I haven't gotten any so far this year. So hopefully we won't. That's pretty much everything I had in my report for you today.
This year, the last 7 days?
That'll be the last 12 months of 18. How about that?
Question, how are we doing with the hepatitis A and hepatitis C?
Well, I think last month or the month before, I reported that hepatitis A is still being transmitted primarily in the southeast Michigan counties. It is less of a problem now outside southeast Michigan, but we've been encouraged to continue to reach out to populations at risk locally and to offer immunization. We got another $5,000 in our budget this year to do that, so that's our plan to continue to do it. We still don't have a case associated with this outbreak in Jackson County, and maybe it's because we're getting to the people that we need to vaccinate. We're hoping. Hepatitis C continues to be a pretty significant concern for us. With the amount of opioid addiction that's in place in the community, the amount of IV drug use, that's primarily where hepatitis C is getting transmitted. Not so much on the HIV side, but hepatitis C, the numbers are pretty striking in terms of the amount that we've seen here on the acute side in Jackson County. We actually have some data we probably should bring and share with you on that. So we will do that.
Any other questions, Commissioner?
Yes, I just have just one question. You mentioned that there may be some contaminants in the Grand River and that there was some possible testing going on right now. Do you know how long it would take for them to find anything, and then how long that report would take?
The testing, I understand that the river is already, samples have already been taken or will be taken shortly, and it probably takes about a 4-week turnaround from the laboratory that the state of Michigan is using, which is based in Colorado.
Okay.
So we should know within a month.
Okay. Thank you. That's all I have.
You're welcome.
Good afternoon.
Hey.
Looking forward to that teen pregnancy meeting on the 15th, correct?
Glad to have you.
And then I just had a quick request also, whenever we can get the statistics on Hep C for the rest of the STDs
Sure.
as well.
Yep. We've been working hard on it.
Yeah, I appreciate
Apologies
it.
for not getting it to you by now.
No, it's okay. It's okay. I know it's a lot of data to gather up, so I appreciate it.
You're welcome.
Controversial question. Well, go ahead. Go ahead.
Don, I was wondering, could you tell us how deep the monitoring wells are at the
At the plant?
Mistler plant?
Yeah. Actually, I don't have that data with me today. I don't know how deep they are. I can find out.
I'd be interested to know what aquifer, how far they go down.
Sure.
Richard, what is, if you know, the half-life, or how does these chemicals dissipate?
Well, I wish I could tell you that they dissipate. They really don't.
Well, then it's not if they don't dissipate, it's not of when, it's just a matter of time, or whatever I'm trying to say, when they show up in the aquifers, because if they're in this water,
Yeah.
it's only a matter of time before they get to.
Yeah, it's a matter of time before they find a way to move in the aquifer to some location where you don't want them. Right. They consider them, they're actually labeling them as forever chemicals. That's how long chain they are, unfortunately. They can be removed relatively effectively with charcoal beds, but that's a long-term water stripping process, and if you had to do it, that's probably how you would do it. It would be expensive. Well, point-of-use filters is a solution whenever we encounter a situation across the state where the parts per trillion is 70 or higher. The use of point-of-use water filters is recommended, and that's pretty effective. That's a short-term solution. It's not intended to be long-term. In the Oscoda area, where they've really had a problem with the Air Force Base, they've actually extended municipal water supply systems to people with wells because they're contaminated to the point where they probably can't get them effectively cleaned up. That was probably the less expensive solution. So let's hope we don't have to do that here in Jackson. They all come from an aquifer. Yeah, we're not pulling anything from the river here in Jackson County, so that's to our favor.
Any other questions? One question, with the increase in hepatitis C, okay, does the health department have any opinion about a needle exchange program?
Well, our opinion would be that all the data that we've looked at from sites that have done needle exchange programs, including those in Michigan and what the CDC has published as well, is that they are particularly effective at reducing transmission of hepatitis C when it's properly done in a controlled environment with an organization that is charged or willing to do that, yes.
I've heard that the cost of treating one hepatitis C patient, okay, over the, 4 or 6 months, would cover a needle exchange program and cost.
Oh, absolutely. Mm-hmm.
Okay.
Yes,
Any other questions, commissioners? Okay.
welcome.